Obamacare, like Ivy said, has many names. It's known as ACA, Marketplace. That's actually the name I prefer because it starts out with the idea that it's not an insurance. A lot of our patients come here thinking that Obamacare is going to be an insurance itself, like Medicare or Medicaid. But no, I try to make them understand that it is literally a marketplace where you go and choose your own health insurance. So calling it that sort of helps them get into the right track of mind for when we start. Over 1 million people have been benefiting in Wisconsin as of December 2013. I wish I could have like a more specific number, but it's just not out there yet. We've tried to find out. It's really hard. There are no actually solid numbers yet, but it is in the millions, so that's something. And as you all know, or probably know, it became law on March 30th of 2010. There's been a lot of changes since then, and this is what it all led up to. Okay. Now, the drawback, the individual mandate. This is what most people are fearing about, the fee. And in the enrollment deadline of March 31st, 2014, which just passed, people are thinking, sometimes correctly, that after that point you can't sign up for insurance and that they will have to deal with some sort of fee. Well, that fee is exactly, it's going to be roughly $95 per adult or $47.50 per child, or 1% of your income of the year. More than likely, it's going to be the 1%. It's always the one that costs more. And in the next oncoming years, it's going to be going up a little bit more than that every year, basically. But however, some people do get to apply for exemptions if they don't get insurance in that time, usually because they just can't afford it. The cheapest one is not reasonably something they can pay for. However, something that it's very important to consider at this point is the question of, is it too late? The answer to this question is the special enrollment period, and it's not too late. It's usually never too late. The special enrollment period is a situation where a 60-day window is open for any person and any time throughout the year in which they can apply for a marketplace insurance, no matter what. And there are many ways where you can qualify for one. Basically, any sort of change in your life, from employment to citizen status, income, anything like that, anything can trigger a special enrollment period, and you can come here and see me, and I can help you with that. Loss of job coverage, which is happening a lot. We're seeing that a lot lately because jobs are trying not to offer coverage anymore because the new expenses and the new requirements. So if that happens, you can still come here with me. Rejection by Medicaid and Medicare Plus. This is a very important one because people are applying for Medicare even though they don't have it yet, and they're getting a letter for rejection after March 31st. You can still, that counts. You can come to me. A special and social service specialist, you will know this, you will deal with this the most, and you will point those people out to me. And I really appreciate all you've been doing, by the way. And many others. That's the thing. You just never know when you might qualify for one. And you lose nothing but coming to me and trying to find out. We can always just apply for special enrollment period, and if you don't qualify, no loss for you. How the game changed. Now, here's what health insurance looked like before 2014. We had the private health insurance, which is, basically either people that really have a lot of money coming in and they're willing to pay like $500 per person a month for their own private insurance, or more than likely people that get insurance through a job, like basically anybody here, or most of the people here anyway. And then there's the government Medicaid and Medicare Center. You all know how that works. A lot of people in the waiting list, a lot of people not getting anything. That list was miles and miles long. Now, here in 2014 and after, this is what we're looking at. Still the same thing. And nothing has been taken away. Just stuff has been added. Government Medicaid, that's still there. People now, thanks to the marketplace, hopefully people aren't waiting as long. Private insurance and companies, we also still have that. Nobody has taken away our job coverage, at least in most cases. And then there's the marketplace now, which is what I deal with, what I help people with. This is also a great chart to use, so you know how the game has changed. Basically, if you make up to 300% of the federal poverty line and you're pregnant, you're going to go to Medicare easily. Same with children. However, you might pay a small premium after 1,200%. Parents or caretakers or childless adults, Below 100%, they go to the budget care, but afterwards they just come to me. And they're usually going to get some sort of help, either both of the government programs or just one. Either way, I'd be happy to help in any way I can. And family services, there are basically no changes on that or on the elderly. So, a lot of people come here worried about their Medicare being taken away. We can just tell them that no, so long as there's really no change for them in that. Now, this is just really quick, very basic information of what you could be looking at in a marketplace plan. This is something I always tell all the patients when we get to the point where they have to choose a plan. There are 87 plans that you can choose from, and all of them are divided into 4 levels. And
that's just Milwaukee, right?
Yeah, that's just Milwaukee. And that tends to be a little bit daunting for the people, because these are people that most of them have been on budget care most of their lives, so they don't really understand deductibles, co-pays, that sort of thing, premiums. But I try to break it. This chart is very useful to break it down as much as I can. How much it covers, the costs more or less, how it goes up, how it goes down, the deductibles. It's just something that has been really useful for me. And honestly, just by looking at it, you can sort of get an idea of what you're going to need. Even past the deadlines, we might be able to help you. You lose nothing but trying. Even if they say no, you don't qualify for special enrollment period, you lose nothing just by trying. So please always remember that no matter who you see, no matter what the situation is, I'm always happy to try and help them. Okay? Co-insurance is sort of like the percentage that you pay for for a service that you're being provided medically. For example, you go to the doctor and your insurance is 20%. The co-insurance is 20%. Your coverage is going to cover 80%, and you're going to be responsible for the rest. The co-pays are a fixed amount that you're going to be paying for your appointment. For example, a doctor's appointment might cost $15. You're responsible for those $15, plus the co-insurance, which is what I already explained. Some insurances let you have this sort of option depending on who to go to. Some doctors, some providers is only a co-pay. Some providers is only a co-insurance. Some is both. It just depends on what plan you choose and who you go with. Usually, the only problems that I would see is their income. Homeless people usually don't have income, and if that's the case, they wouldn't qualify for the marketplace to begin with. I send them to budget care. But let's say for whatever reason this is somebody that's homeless and does have a job enough to qualify. All that really affects is that we need to provide some sort of address, and what we usually do in that situation is provide the mailing address as this place. Now, here's what I think is the important part about my presentation. Here's the stuff that you guys don't often hear, but I think you deserve to. These are the success stories that you guys have all been part of. This is any social service specialist that has pointed these people out to me. You're responsible for this, and you need to know that these people are grateful.